presentation of my findings on the care group training cascade for both the Aranda and the Niigata catchments. And feel free to stop me anytime. I'll be doing the quantitative results first and then the qualitative sections. Okay, so just a reminder of the research questions. We focused on if field officers and promoters are holding meetings twice a month, are promoters completing the required home visits, are CGBs completing the required home visits. We also wanted to look at what % of care group and neighbor group lessons have an attendance rate of 80% or higher. We wanted to look at to what extent are promoters and CGVs completing the most important aspects of care group and neighbor group meetings. We also looked at our CGVs completing the most important aspects of home visits. And then finally, our promoters conducting quarterly QIVCs of neighbor group meetings and home visits. So first, we'll look at results for the Aranda catchment. So I wanted to go over program reach. So the average attendance of all care group and neighbor group meetings and completion of home visits were used as a proxy to estimate the program's reach. Both group meetings and home visits performed just below the benchmark goal of 80%, with group meetings averaging at 76% and home visit completions averaging at 64%. When looking at home visits, overall promoters performed below the 80% benchmark goal for both first and home visits. Promoters completed 68% of the intended first home visits and 69% of the intended second home visits. Of the 9 promoters, 2 met the 80% benchmark goal for both first and second home visits. CGVs in all 9 care groups performed below the 80% benchmark goal for both first and second home visits. The averages of completed first home visits across all CGVs in 9 care groups was 61% for home visit 1 and 58% for home visit 2. Care group volunteers in care group 5 had the highest average completion for both home visits. So for first quarter, they had 77% completed, and then for second quarter, they had 74%. And CGVs in care group 7 had the lowest, with 48% in first quarter and 47% of home visits completed in second quarter. When you look at the attendance of group meetings, I use attendance records for care group and neighbor group meetings as a proxy to assess whether or not promoters held the required meetings twice a month. So all the promoters and CGVs in Aranda facilitated the intended 2 care group and neighbor group meetings per month. The average attendance rate across all care group meetings from October 2019 to May 20 was 81%, which meets the 80% benchmark goal. Of all the care group meetings held in the 8 months, 56% achieved an attendance rate of 80% or higher. So to compare, neighbor group meetings had a lower attendance rate with an average of 71% across all 9 care groups. CGVs in care group 6 had the highest average attendance. Their attendance rate was 80%, and then they were followed by CGVs in care group 3, who had an attendance rate of 78%. Additionally, 28% of the neighbor group meetings held during the 8 months had an attendance rate of 80% or higher. One of the indicators to measure care group attendance was to look at the data pulled from the 3rd peripheral home visit during routine home visitations. CHVs completed a combined total of 90 3rd peripheral home visits, and during the 8 months, the women reported attending 91 care group meetings. In Aranda, the percentage of mothers who reported attending at least 1 care group meeting in the previous months increased from 70% in quarter 1 to 80% in quarter 2, which is great. Okay, so next I looked at QIVC performance scores of promoters and CGVs. The QIVC analysis focused on 3 performance measurements for group lesson facilitation and 1 performance for home visits. For group lesson facilitation, I looked at questions focused on meeting facilitation skills, essential group meeting indicators, and mastery of lesson content. For assessing home visits, I looked at the essential home visit indicators, which were only used to assess CGVs. Promoters weren't assessed on it, or there just was no data on it. And then I included the average QIVC performance scores for all the questions regarding group facilitation and home visits to get an overall picture of program performance. Okay, so the QIVC performance scores for Aranda promoters and CGVs are divided by quarter one, which was between January 2020 and March 2020, and quarter two, which was April 2020 to June 2020. The data showed high performance averages across all three categories. The average QIVC performance scores met the 80% benchmark goal for both quarters. For CGVs, QIVC scores for home visits were also included in the performance analysis. Before I go into the scores, I wanted to mention that promoters in Aranda completed 93% of their expected QIVCs for home visits in quarter one and 96% in quarter two. And then promoters completed 96% of QIVCs for facilitation for both quarter one and quarter two. So overall, QIVC performance averages increased from 78% to 85% for group lesson facilitation. Average QIVC scores for home visits increased from 76% in quarter one to 84% in quarter two. So when you take a closer look at the performance indicators, meeting facilitation skills and mastery of lesson content met the 80% benchmark goal for both quarters, with the exception of an 85% score in quarter two for essential group meeting indicators. The remaining categories scored below the benchmark goal. So we're going to move on to Niagato. Again, I use average attendance. Oops, my bad. Okay, so using average attendance rates and completion of home visits, I calculated the program's reach in Niagato. The catchment had an average attendance of 79% across all group meetings and 82% completion of home visits. Although care groups in Niagato were launched this year, early data shows that they are performing above the benchmark goal for home visits and are just shy of reaching the goal for group meetings. Again, these numbers serve as a proxy to the program's reach so far. So promoters in Niagato met the benchmark goal for both home visits with a completion average of 82% for first home visits and 84% for second home visits. Of the 6 promoters, 3 met the 80% benchmark goal for both first and second home visits. While CGVs in Niagato completed 82% of their first home visits and 79% of their second home visits, care group volunteers in care group 2 had the highest completion with an average of 100% for both home visits. Okay, so first off, all promoters and CGVs in Niagato facilitated the intended 2 care group and neighbor group meetings per month. The average attendance rate for all care group meetings held from March to May was 83%. 5 of the 6 promoters had an average attendance rate that was higher than the program goal of 80% or higher. Of the care group meetings held during the 3 months, 61% had an attendance rate of 80% or higher. So when you look at neighbor group meetings, they performed below the benchmark goal with an average attendance of 74% across all 6 care groups, with 31% of these meetings achieving an attendance rate of 80% or higher. Only 1 care group had an average attendance rate that met the program goal, which was care group 6. They had an attendance rate of 81%, and care group 2 had the lowest average with an attendance rate of 62%. When looking at CG attendance by postpartum women in the routine home visitation intervention program, it's better to look at quarter 2 since Niagato started care groups in February. Between April and June, CHVs completed 30 third purple home visits, and the women reported attending a total of 37 care group meetings. 80% of the women that CHVs visited in quarter 2 reported attending at least 1 care group meeting in the previous month. And again, because Niagato launched care groups in February, quarter 1 doesn't really have a complete record of the data to analyze QIVC scores for promoters. Average QIVC scores were collected for 4 of the 6 promoters during quarter 1 and 3 of the 6 promoters in quarter 2. Quarter 1 had an overall average QIVC score of 68%, performing below quarter 2, which averaged at 71%. So performance scores were further broken down to each of the promoters. In quarter 1, promoter Shelish had the highest overall performance score with an average of 92%, while Selfine had the lowest with an average score of 43%. Promoters Fred and Zipporah were not evaluated during this quarter. For quarter 2, promoters showed the highest proficiency in mastery of lesson content with a consistent score of 100% across the board. Both Richard and Evans received an overall average performance score of 75%, while Selfine received an average score of 63%. Promoters Fred, Zipporah, and Shelish were not evaluated this quarter. Before going into the scores of CGVs, I wanted to mention the completion scores of Niagato promoters in completing QIVCs. Promoters completed 50% of their QIVCs to neighbor group meeting facilitation in quarter 1 and 80% in quarter 2. To assess home visits, promoters completed 13% of their QIVCs for quarter 1 and 73% for quarter 2. Average QIVC group lesson facilitation scores across all care group volunteers in Niagato were below the 80% benchmark goal with a score of 62% in quarter 1 and 71% in quarter 2. Average QIVC scores for home visits performed below the benchmark goal with a score of 73% for quarter 1 and 75% for quarter 2. So further breakdown of scores by each category revealed that CGVs received the highest performance scores for mastery of lesson content and the lowest performance scores for essential home visit indicators. Okay, so moving on to the discussion. As far as program reach, Aranda is performing below the intended goal. In Niagato, the program's reach meets the benchmark goal for home visits with 82% completion, while group meetings are just shy of reaching the benchmark goal with a 79% attendance rate. For home visits, average home visit completion rates by Aranda promoters and CGVs are below the benchmark goal, while promoters and CGVs in Niagato are meeting the 80% completion home visits. Home visits ensure that mothers are following health behaviors that were taught during group lessons, and it also gives mothers the opportunity to ask any questions that they may have. I think it would be in the best interest to look into any barriers that prevent participants from completing their home visits. As far as attendance rate, the attendance of women in care group meetings is higher when you compare it to neighbor group meetings for both Aranda and Niagato. For both catchments, care group meetings are performing higher than the 80% benchmark goal, while neighbor group meetings are underperforming. Because group lessons are the initial introduction to each unit of the curriculum, low attendance can affect subsequent steps of the intervention. So for example, a missed group lesson requires a facilitator to make an additional home visit to the mother, requiring further coordination and adding to her workload. Ensuring attendance of care group and neighbor group meetings will definitely make the intervention run more smoothly. For QIVC scores, promoters in Aranda received high performance scores for quarter 1, which had an average of 90%, and quarter 2, which had an average of 83%. Since Niagato is missing assessment for 2 promoters, it is difficult to make proper evaluation of their performance as a group. Moving forward, it'll be important to make sure that all promoters are assessed for proper evaluation. And then moving on to CGVs, across all QIVC categories, CGVs in both catchments showed an increase of performance scores when you look at quarter 1 to quarter 2. So this is a positive development indicating that the more experienced CGVs have in their role, the better the quality of their performance. And the table depicting average QIVC scores of each care group, volunteers by each care group, helps highlight the groups, which groups are performing well and which may need more training. Does anybody have any questions before I move on to results of the focus group? Okay. So moving on, just a review of the 6 research questions that guided the focus group. We wanted to look at how promoters, CGVs, and neighbor women felt about their involvement with care groups. We wanted to look at how they felt about the lessons they receive and then the support that they are provided with. We looked at what do promoters and CGVs think about their facilitation of care group and neighbor group meetings. What do promoters, CGVs, and neighbor women think about the content and structure of the care group lessons? And how do promoters, CGVs, and neighbor women feel about the current state of home visits? And then finally, we looked at how promoters and CGVs feel about their ability to collect and manage project data. Okay, so for roles and responsibilities, both care group volunteers and promoters displayed a clear understanding of their responsibilities and the cascading structure of the care group program. And both the Aranda and Niagato promoters explained the necessity to attend biweekly lessons facilitated by field officers in order to train CGVs. They talked about the importance of conducting home visits, collecting registers from CGVs, and completing QIVC forms. When CGVs were asked about their role in the program, they discussed their responsibility to pass down information they learned from promoters to neighbor women, conduct home visits, and complete neighbor group registers. So both promoters and CGVs explain the importance of doing home visits twice a month and if a participant misses a group meeting. And then when I looked at results from the neighbor women, they also demonstrated an expectation that if they did miss a neighbor women meeting, then a CGV will come to her house and teach her the lesson plan. An expected outcome is that CGVs serve as role models in their communities by practicing the healthy behaviors that they teach to the neighbor women. One interesting thing I found is that they also feel that their neighbor group serves as social support groups. So I highlighted one quote from a neighbor woman from Niagato. She said, "The care group is a form of small cooperative group where we encourage and support each other, not only on the lesson on health, but also financial support. This motivated me to keep participating in the care group because there is more to it than just health." As far as barriers to meeting their responsibilities, the participants mentioned the following. All focus group discussion participants expressed that tardiness is a significant challenge. Care group and neighbor group meetings may run longer than expected if the facilitator has to wait for more women to arrive before starting, which isn't fair to the women who were on time to the meetings. Migration was also another interesting finding. It was a barrier that some of the women listed. Women who migrate out of the town only to return after a few weeks serve as a challenge for promoters and CGVs. Because some of the women are gone for periods of time, their CGV or promoter must meet with them to make up the missed lessons, which add to an additional responsibility. A barrier that participants mentioned was a lack of credibility because they didn't have identification to prove their involvement with care groups. So promoters are given uniforms, but CGVs requested them as well because it represents their role in the program. They also explained that wearing uniforms increases their credibility to their own husbands and to the husbands they meet when they conduct home visits. They suggested that a uniform could be a t-shirt, a badge, or even a bag with the KeyCop logo that they can also carry their papers in. Neighbor women also requested uniforms to show their involvement with the care group. Okay, so moving on to what motivates the women to participate. Participants cited that one external motivation is witnessing the change in the behaviors of their community members. Changes that participants listed include an increase in hospital deliveries and utilization of healthcare services for sick children. When people saw the change, they were motivated to be involved with care groups. For example, one woman said that she witnessed the community health volunteer going around the village checking on families and liked how she was teaching them, so then she decided to become involved. Another internal motivation that promoters, CGVs, and neighbor women expressed was the confidence they gained from their ability to take care of their families because of the lessons they learned. In addition, CGVs and promoters expressed that their role as educators have gained them respect in their own communities and are referred to as daktaris. This serves as a positive reinforcement for the women and encourages them to continue to participate. So for the participants in the Niagato catchment, the emergence of COVID was a significant motivator for their initial interest in care groups. They expressed that involvement in the program taught them ways to protect themselves and their households from contracting the virus. So although participants expressed that they enjoy going to lessons, they did list some barriers that may prevent them from participating. Many of the women cited bad weather and transportation issues as reasons for low attendance. Other barriers that were cited was having to work during the scheduled meeting or disputes with their husband over this. For example, a husband may claim that his wife's involvement in the program is not beneficial because she is not receiving payment for her work. So to avoid an argument with her husband, she may just skip a meeting. So on top of that, participants expressed that their husbands also believe that they should be taking care of their children instead of going to meetings. As a compromise, some women may bring their children to the meeting so that they don't have to miss a lesson. However, they may have difficulty taking care of their children and paying attention at the same time. So as a result, she will likely miss the next meeting if she has to bring her children. So because many of the women cited their husbands as a barrier to participation, they requested that their husbands be somewhat engaged with care groups so that they can see the value in it. So in addition, many participants recommended that marital counseling be a lesson topic so that the women can be better equipped to deal with disputes at home. When asked if the husband should attend the lessons, there was some disagreement. One thing I found interesting that what participants in the Niagato catchment suggested is that KCOP advertised the care group program to increase awareness and gain support from their husbands and the community. So promoters and CGVs explained that many of the women request items as a reward for their completion of a lesson or a home visit. Some have indicated that items that correspond to lesson plans, so for example, passing out soap during hygiene lessons should be supplied to all participants. And I know that KeyCop has given women these incentives in the past, but the women have requested that it be distributed more frequently. In addition, monetary compensation was frequently requested from CGVs and neighbor women. Promoters and CGVs have explained that sometimes participants complain that they leave care group or neighbor group meetings empty-handed and could have used the time spent during meetings to work and provide for their family. So moving on to the state of care group and neighbor group meetings, there was a general consensus that receiving lessons twice a month is ideal. The only group that disagreed is the neighbor women from Aranda. All of the participants from that group agreed that they should be increased, but they didn't really clarify by how much. And they also stated that the time allotted for the delivery of each program plan should also be increased. So when the women were asked about things that have helped them lead neighbor groups, some of the care group volunteers mentioned that they use a merry-go-round system during their group meetings. And this is when each member contributes a small amount of money to the woman who is hosting the meeting to provide small refreshments. And the benefit of this system is that it brings a sense of community and also motivates the women to attend. The use of activities and pictures during meetings were commonly cited as a way to enhance the lesson plans. Pictures in particular were emphasized to illustrate main takeaways of each topic and were especially helpful because the women had different reading levels. Because of this, they also suggested that the lesson materials have less text and more pictures that were also colored. In addition, CGVs in Aranda and Niagato mentioned that the meetings and lesson materials should be in Swahili or the local language to accommodate to the various literacy levels and speaking proficiency of the members. The women also recommended that there should be enough lesson materials for every woman in the care group and neighbor group meeting to take home. They explained that this will allow the woman to review the materials at home and also share the resources with her family. When asked how the participants felt about the lessons they received, there was a common consensus that every lesson was beneficial, which is great news. They went on to explain how they applied the lessons at home. For the Niagato catchment in particular, the COVID-19 lessons have helped participants recognize symptoms, risk factors, and practice preventative measures. None of the participants stated that a lesson was not beneficial. Future topics that participants recommended included marital counseling, growth monitoring, communicable diseases like TB and STDs, and non-communicable diseases like high blood pressure, diabetes, and cancer. So focusing on the quality of trainings provided by facilitators, facilitators of the care group and neighbor group meetings were cited to be humble, timely, and enthusiastic. Participants stated that facilitators created a welcoming environment that encouraged participation. The women also expressed that facilitators knew each of them by their name and that they felt respected and listened to. So according to participants, facilitators demonstrated a clear understanding of the lesson topics. CGVs also noted that promoters emphasized the importance of training them so that they can properly perform their tasks for the neighbor women. Participants explained that when there was confusion, facilitators were able to explain in different ways to help them get a clear understanding. They also stated that they felt comfortable enough to ask questions and believe facilitators did a good job in responding to them. When asked about the state of home visits, these were the main findings. Promoters, CGVs, and neighbor women explained the benefit of home visits as a way to reinforce lessons during meetings. So for promoters and CGVs, the home visits gave them the opportunity to re-engage with the women and confirm that they're properly following the key messages from the lesson plans. And then the one-on-one structure of the home visits also helps to strengthen the relationship between the facilitator and the participant, which is something that they don't really get during the group meetings. The home visits not only allow promoters and CGVs to interact with the mother, but they also allow them to engage and check on the well-being of the family members, as well as demonstrate to the family the benefit of care groups. So that being said, many of the women believe that unsupportive husbands made it difficult to complete home visits if the promoter or the CGV feels unwelcomed in the home. Since the emergence of COVID, the 2 lesson plans that the KeyCop project created included topics about identifying symptoms, preventative measures like social distancing, wearing masks, using hand sanitizer, and proper hand washing. The lessons were received very well by women in both catchments, and participants demonstrated a clear understanding of what they have learned from it. Okay, so the next topic is collecting and managing project data. So promoters demonstrated an understanding of collecting registers and completing the promoter summary sheets. When asked if they would like further training on collecting and managing data, promoters from both Aranda and Niigata believed that this wasn't necessary. As far as CGVs, they demonstrate the importance of completing the neighbor group registers and showed an understanding of what qualifies as a vital event. They also acknowledge that the neighbor group registers help them get a better understanding of the welfare of their groups. The care group volunteers in Niigata said that they knew how to fill out the registers and didn't request any further training. But CGVs in Aranda stated that they had significant trouble filling out the register. They described the register as being confusing and prefer to have a simpler version. They also indicated that they would like more training on how to properly fill out the register. So the focus group discussions gave better insight on the experience of participants and a closer analysis of each level of the cascading structure. The success of care groups is demonstrated through the increased knowledge of the participants and the change they have witnessed in their homes and in their communities. They have enjoyed their experience during lessons and have positive relationships with their facilitators. The focus group discussions have also listed barriers and challenges and revealed areas that need improvement. So a significant challenge and barrier to participation that all women in every group discuss is conflict with their husbands. As mentioned earlier, husband disapproval can prevent a woman from completing her responsibilities or even attending a care group or neighbor group meeting. In addition, if a woman gets into an argument with her husband before attending a home visit or a care group or neighbor group meeting, it may affect her level of engagement. So most importantly, there seems to be a snowball effect. So when one woman is unable to fill her responsibility, it impacts the women above her in the cascading structure. So for example, if a neighbor woman's husband prevents her from attending a meeting, it'll cause her care group volunteer to make an extra home visit as a substitute for the missed lesson. Because this requires the CGV to make an extra trip in order to fulfill her responsibility, her husband may also disapprove, saying that she is committing too much time to the program. This can lead to other problems that the women have listed, which includes distrust from spouses if they believe she is secretly hiding payments, or the husband may say that she should use her time working instead of participating in the program. So as a result of that, her husband may prevent her from attending a care group lesson herself, which then will require her promoter to make a home visit so that she receives the vital information. So now the promoter may experience the same troubles that the CGV experiences. So although the care group model is targeted towards women, husbands have a significant impact on the ability of the women to fulfill their roles and can affect the success of the project. So for this reason, the role and impact of the husbands has emerged as a really big theme throughout the analysis. So moving on to another key finding, tardiness is a problem that both care group volunteers and promoters mention. Facilitators have tried to cope with lateness by waiting until enough women have arrived to start this meeting. However, this discourages attendants from coming to meetings on time if they know that they have to wait anyway. So then to avoid that, they'll also come late to the meeting, which just creates like a cycle of tardiness. And then lastly, all of the neighbor women and CGVs requested incentives for their involvement. Although promoters are paid for their participation, CGVs have expressed to them that they should either be paid or receive more incentives. So CGVs have reported the same findings for neighbor women in both catchments. Although KeyCop does provide some incentives throughout the program, the women have requested that it be more consistent, and lack of incentives may also lead to marital disputes if the husband thinks that her involvement with care groups is not beneficial if she comes home empty-handed. And as a result, he may also prevent his wife from participating in the program in the future. Okay, so based on the results of the qualitative analysis, I had 14 recommendations, and feel free to stop me anytime because your input is really important on if any of these suggestions is practical or beneficial for the women or for you guys as staff members. So the first suggestion is to increase the frequency of incentives given during care group and neighbor group meetings and home visits. So distribution can be random to incentivize women to attend all appointments, and incentives can be related to the lesson plan, so soap, diapers, basins, and those were just examples that some of the women gave. And also, you can include items that the women have requested. So due to the bad weather, they requested umbrellas and rain boots. So the second suggestion is to present the merry-go-round system as an option for all care group and neighbor group meetings. So participants in the Rhonda catchment have indicated that has been effective, and implementation may encourage participation and attendance. So to combat tardiness, promoters or CGVs can implement a policy that if a woman is late, she must pay a small late fee, but the money collected from late fees will only be used towards the care group and neighbor group meetings, like providing refreshments. So this system is already in place in the Rhonda catchment for promoters attending lessons with their field officer. The fourth suggestion is to increase the use of pictures in lesson materials. Both Aranda and Niagato indicated that pictures have been essential in understanding concepts and requested that they should be used more. Lesson materials and facilitation should be in Swahili or the local language. The sixth recommendation is lesson materials should be given to each participant after a care group or neighbor group meeting that summarizes main concepts so she can look over it when she goes home. Another one is to include more activities during meetings to engage participants. Most of the women said the activities was one of their favorite parts of the group meetings. And then future topics should cover marital counseling, growth monitoring, communicable diseases, and non-communicable diseases. And these are all suggestions that the women have made. And then the ninth suggestion is that a survey should be given to participants to gauge if and how women would like their husbands to be involved in care groups. So for example, one lesson can be focused on marital counseling, and the women can decide if husbands should either attend the group with them or that the women attend alone, and then they pass the information on to their husbands. The 10th suggestion is to provide uniforms to CGVs and neighbor women to signify their involvement with care groups. And the uniform can either be a t-shirt, a key cop bag, or smaller item like a badge, and just some sort of marker that will help establish their connection to the program and increase their credibility. So advertise the care group program around the community, and this was a suggestion from the Niagato promoters to increase awareness and gain support from the women's husbands in the community. As far as registers and summary sheets, these were all suggestions from you guys or from the women. The first one was to conduct an additional training for Aranda CGVs on how to fill out the registers, and they said that they wanted more training because it was too difficult for them. Second one is to include a column that indicates if participants received a home visit when they missed a care group and neighbor group meeting. I think this was something that we wanted to figure out before, just to see how many of CGVs and promoters are giving home visits for the women who missed a group meeting. The next one is to add a column to indicate new pregnancies, clarify migration in the sheet as out migration, and then add an in migration column. Add a column to mark women who have graduated from the program, so children who are 24 months and above who leave the group. Establish a policy for women who have migrated but later returned to their care groups, and some of the promoters and CGVs said having to go back and conduct home visits for the women who migrated adds additional responsibility to them. And then lastly, provide certificates for neighbor women who have graduated from the program. CGVs and promoters should receive a certificate of training for their role as facilitators. And then this can double as an incentive for CGVs and promoters because it demonstrates the skills that they have acquired and may help with future employment. And that is my presentation. Does anybody have any questions? If not, thank you guys. I really appreciate your help, especially Barbara and Kevin and Anne.
Hey, Meki.
Hey, Kevin.
Anne is here. Anne, say hi.
Hi, Anne. Hi. How are you? Okay. Do you guys have any questions?
Yes.
Yes, we have questions. We can start with Anne asking his questions, and then I will ask my questions, and then Meka and Caleb will also have their questions. Thank you.
Okay.
Anne. So if you can open the recommendation section in
Sure.
your presentation. Yeah.
Do you want to go to this slide or the next one?
I did that slide.
Mhm.
Thank you very much.
Okay.
Yes, thank you. Thank you. I can see Barbara. Hi, Barbara.
Hi, Anne.
Yeah, thank you very much for the analysis. It was a good one, and from this we learn a lot and know where to improve. And for the recommendations, thank you too. But then there are things that we cannot guarantee, like now, number one.
Hey, Anne, I don't know if it's just me, but your voice is kind of distant.
Yeah, I'm having the same issue. Could you move just a little closer?
Yeah.
We need a microphone we can pass around on that side.
What I would say, you can hear me now?
Yes, yeah.
Yes. Thank you very much for the research. It was good, and I can see there's a lot that we need to learn about. And one of the takeaways that I've gotten from here is about time. And I think we need a lesson, a training on time management, both for the CHB, the promoters, CHBs. Because now it starts with the CHBs, then the promoters at the same level. If they don't keep time, the women will not keep time. So Barbara was asking for a lesson for the CHPs on timekeeping because we really struggle with timekeeping for all over the months. There's no time that the CHPs have been able to keep time. There's no time that the promoters have been able to keep time. So a lesson on a training on timekeeping will work good for us. Then something else that I wanted to talk about is number one on the recommendation. Yeah, it's a good recommendation, but we can't afford to do frequency on incentives. And also, I'll talk about number five. Number five is a good recommendation, but what we do is similar to what the women have asked for. What we do, we train the promoters in English, and then we make sure the promoters really understand the lesson. So when they're going to train the CGVs, they train in the local language in a way that the mother can understand, because we cannot afford to translate all these materials to our local language. So what we do, we train the promoters, enable the promoters to train in the local language, and help the CGV train using the pictures. So the CGV will be training using the pictures, will not be reading the materials. So what we will do here is to help the promoter to work more on the promoters. Maybe there's something we're not doing right. So we'll take more time with the promoter. If the lesson is supposed to be 1 hour, we'll take 2 hours with the promoters to enable them to train without reading, using the pictures and in their local language. So we'll spend more time with the promoters, yeah. And something else I was talking about, the merry-go-rounds are fine. And I've talked about time. Increasing lesson materials, pictures, yes, but the number of lessons, 2 is enough. Yes. Then to the next page. Then also giving lessons to each, but to each neighbor women will be a bit costly. It's not affordable for us. What we can do is to ensure every CGV gives the lesson to every woman by the time the next lesson date reaches. So every woman will have a time to be with the lesson in her house to share with the family. Activities, we can add 1 activity, but so far 1 is enough. In regard to the time, they ask for a 1 hour, 30 minutes lesson. So above that, it will be tiresome and boring. That is all I had. About the uniforms. About the uniforms, number 10, we've been looking for ways to get donors to help us get lessons for, maybe lessons and t-shirts for the CGVs. But now the problem with giving the CGVs lessons, remember women will want lessons, will want the lessons of the t-shirts. because they can't be taught with CGBs who have uniform and they don't have anything to show that they're K-pop neighbor women. So it has been a challenge. We are getting small-scale assistance for only t-shirts or lesos for CGBs. So I don't know how we will do so that we can get lesos and t-shirts for the neighbor women so that they don't get restless and maybe start fighting the CGBs.
Mm-hmm.
Yes, yeah.
Mm-hmm.
Just to add on that, incentives we have proven to be a really thorn in our flesh, because when you do incentives, you have to do cascade it from all levels, from promoters to care group volunteers to neighbor women. Because if neighbor women see care group volunteers with t-shirts or soap and something of that sort, and them not having, it brings a very big issue, issue. So I don't know how we'll be able to, I don't know if this is a challenge for care groups all over the world, or it's just for our context, because yes, incentives really attract participation, but on the flip side, they can really be a source of conflict. So when you look at the cost-benefit analysis, sometimes it's we'd rather just do without incentives.
Okay.
Yeah.
So yes, and to add something on the incentives, it has worked well for us in a smaller percentage, but in a bigger percentage, it has caused more harm. Because now there are those who will not attend the lesson, but will want to get the incentive. If they don't get the incentive, they will never come. And there are those who come for the lesson not because of the education, but because they expect something at the end of the lesson. And if that incentive is not there, they get annoyed. And so when we move to another catchment where we need to cascade the care group approach, I don't think incentives will work for us. We've really learned this from on-job training. Incentives don't work. Yeah, and I think Barbara knows that very well. So for another new catchment, incentives will be a no-no from my side.
Okay.
I have a question real quick, Ann and Kevin. So when you talk about like the incentives, so like the lesson materials, like the water or the aqua tab or the like how we had with COVID, like the masks and whatnot, would you recommend that if we expanded, we wouldn't do anything like that? Or are you thinking like no lasos, no boots, no bags, that kind of thing?
So yeah, even for the soap after the wash lesson, they don't really work, because when you decide to distribute soap, there are those who didn't come for the lesson. You'll think about not giving those who didn't come for the lesson, or you'll think about giving even those who didn't come for the lesson. So the others who came for the lesson, the next time will sit at home waiting for the soap. Even if I don't attend the lesson, I still get the soap. That is the notion. And so you get a bigger percentage will be there in care groups just because of the incentives, not because of the lesson. Right? Yeah. So you get a bigger percentage in the lesson, bigger attendance, but now half of the number or more than half of the number is there because of the incentives, not because of the lesson. So we've had a mix of, we've not had a good, we've not been able to distinguish which women are here because of the lesson. Because at the end of the lesson, they really want to, they're waiting, what is this promoter going to give us today? Or what is this CGV going to give us today? And so we've diverted our strategy from the lesson, getting knowledge, to getting incentives. So the incentives don't really work. And from the beginning, I think, Barbara, you talked about this, we fought about this, and we've seen it doesn't work.
Yeah, no, I just think it's so funny because, you know, we started trying to add those occasional small items because of the, you know, in part because we kept hearing from the neighbor women in CGVs that they wanted something, and we're like, oh, well, this could maybe work. And it's interesting to hear that it's actually a bit more detrimental. That's hurting.
Yeah, it has caused more harm than good.
That's annoying.
Between the neighbor women, even between the CHVs and the promoters. Because now the CHVs have their own women that they do routine on visit. Even if they don't get these incentives, they get annoyed. So the relationship the promoters and the CGV has been strained because of incentives. The relationship between neighbor women and CGVs has been strained because of incentives. Relationship between the neighbor women themselves has been strained because of the incentives. Because now I came for the lesson, I gave because the incentive, and also Anne Kerubo didn't come for the lesson and she got incentives. And if we decide to give only those who came for the lesson, those who didn't come for the lesson will never come and will never accept anyone for home visits. So we had a very big challenge that we don't want to incur in the other category.
Do you think that, you know, because I think part of what I'm hearing from Meki's presentation is like, you know, this need to feel recognized by the CGV's need to feel recognized and appreciated. And, you know, I think their first, I don't know, way to do that was mention of incentives. I'm wondering, like, if we had more of like an event, kind of, like an event to appreciate, like, I mean, you know, I know what budget's tight, so this isn't really maybe an option for this year, but like looking forward, like would an event be helpful? More so than
so Barbara, the certificates will work well. We didn't know about that. And also a one-off incentive time. If it's December 25th, we just know it's only December 24th. Once in a year incentive will work, but ongoing incentives will never work. Where we call all the neighbor women, we call all the CGVs together, then we say this is our Christmas package period. Yeah.
Okay, cool. So I guess like when looking at this, you're thinking like a once a year incentive and certificate. So I guess that's some sort of like event maybe, or just handing them out. Okay. And having it maybe be around a holiday, just to like have it.
Around a holiday, and more especially the Christmas holiday, so that they don't expect in any other holiday that there's an incentive. So there's Christmas, December holiday, the last lesson of December, give incentives, and we call all of them together. We call the promoters, the CGVs, the neighbor women, and the CHVs.
Okay, cool. Yeah, I'm taking notes while we talk.
About the advertising of care groups, yeah, this is a new one. I don't know how we can do it, because now this is also costly to advertise using radio. And
I think this is a very brilliant idea. And I think we should develop something like IEC for care group, and yeah, try it out to maybe increase participation to reach our 80% threshold. So maybe we can engage our maybe marketing team there, America, share ideas, design a poster to be mounted somewhere about care groups, to be shared in our community assemblies, in our churches. See if it impacts in increasing the numbers at the community level. Yeah, it's an idea that we can really try.
I had kind of another follow-up question about the attendance. Not the attendance, but like the marketing of the care groups, and how it relates to attendance. It seemed like they also greatly tied like this need for marketing as a way to convince their husbands to let them come. So I didn't know if there were like, or, you know, let the CGV into the home, do the home visits. I didn't know if there were, you know, mechanisms for us to market this to the husbands, or to let them, you know, sensitize them to care groups, either through like CHVs or clan elders, or like if there was another. I think the poster is a great idea. I'm wondering if there's like a way that we can target husbands specifically with marketing.
How it has been done previously, I saw Care Kenya with a big poster on male involvement in town and in front of facility. So poster is one of the way of doing it. The second way of doing it is to target areas where all parents, women and males, are attending, like churches, and community barazas. So maybe we need to brainstorm on better ways with the local administration, on better ways of engaging the males, because actually they are so detrimental to care group attendance, and we need to find better ways of engaging them. Because if you say routine home visits, if you look at the daily calendar that Anna did, most of them are not always in their homes during the day. So that is out of question. For routine home visits, most of them are not there. So that brings you to other platforms. The platforms that are remaining are most men really like listening to radio. Uh, they really love that. That's why most non-profits normally use radio for information. We can try that as one of the ways. Second way, we can try posters. Third way, we can maybe map out male merry-go-rounds. They also have charmers like women. So we can map those out and find ways of design a lesson on like marital counseling that was shared here, and find ways of doing that to the husbands. Yeah. And the most one is churches, even though they are closed right now. That is another way of doing it, because after church, after every service, there's always an announcement. We can take that up. Yeah. And yeah.
Very cool. Thanks, Kevin. And did you
And
have anything? So go ahead.
sports tournaments. Yeah. So those sports tournaments, target those sports areas with very fancy posters. On male involvement, how it has uh, uh, yeah. And then more ideas we'll be able to get from the clan elders. They'll be able to give us more ideas, community based, bottom top.
Cool.
So Meki, for me, I had a question on how you, if you can go behind the presentation and identification, no, credibility, recognition, the how you like brought it out. I felt like you should have brought it out differently. For example, there. Yeah.
Mm-hmm.
For example, confidence.
How did they gain confidence?
There was a credibility slide that was before this, if that's what you're referring to, Kevin.
This one?
Yes. For example, for credibility.
Uh-huh.
So I thought the best, if not this, you should have added one as lack of identification, because identification became key here. In as much as credibility is so much important, identification should become key. So I don't know if we should factor is as credibility or lack of identification, because I felt like they didn't have that identification, like a badge or something. That's why the credibility question came in.
Yeah.
So I don't know if we can also add a bullet on identification.
Sure.
Because I'm sure we have experts from the CGVs that can point out to identification as a very big challenge. Another one that I have issues with is confidence. Just go down.
Right here.
Yeah. So for here, I strongly believe this one is about, it's not about confidence, it's about reward or motivation, not really confidence.
Okay.
Because rewards motivation. Because when you talk about ability to take care of the family, it's how it's normally pegged to incentives. eh? And
Mhm.
so they felt like they are not able to, the kick-off is not providing incentives. That's why their husbands are telling them not to go to the care group lessons.
Mhm.
And so this brings me to another thing of how we will engage the community, because they really need to understand uh, the, that this is not about incentives, this is not about a monetary gain. And in as much as monetary gain will come in a way after the lessons, how do you now bring that topic in to the community? Yeah, like an easier presentation on the key gains to the community. That should be one of the takeaways. How the care group lessons are, for example, malaria reduction, spend economic effects of care groups. Yeah, we should develop maybe a lesson on that, Barbara. Economic economic benefits, because the community is pegging everything on finances and incentives and everything. So this should be one of the introductory lessons as we begin care groups. Yeah. Can I get?
Yeah, I really like that idea, Kevin. I think that, and I think, it's something we can do to like complement that. I totally agree. We should do something when we talk about the economic effects. So I think that will really speak to what Kevin mentioned. I'm also wondering if there is a way, now that we'll have these RHV sheets by community, like a way we can show how KeyCop has like improved the health of the community as well. So like, how can we make sure our feedback loop, where we're providing that feedback to the community and how well they're doing on addressing health issues, like also.
So, Barbara, we also need to find simpler ways of. It's like because we have dashboards
Mhm.
that we present our data yearly. We present our data in vital event census data. The only data that we don't have is morbidity data.
Mhm.
So I don't know if it's a cognition gap among the community, because if we are always mounting this data in our facilities and in our dashboards at the community level, but it's like there's a cognition gap. We also need to find ways of engaging them, engaging the clan elders, engaging the community, and maybe take them to those dashboards and try to let them explain, do you know what this means? So, and then they should let us know if they don't understand and how better to make them understand. Because maybe the graphs can only be understood by those people, the literate group, are not these women and young men who have not completed school. So that is something that I'm noticing that we really need to explore.
Yeah, no, that's really interesting. So something I've heard about before, this I think was at a past core group conference, was, they found that focusing on all of the indicators was too much. And so each quarter they picked one indicator to report on, and made that like an emphasis throughout the quarter. And they had the community, like the groups within the community. So I don't think they used care groups, but they had, what we would be, for us, it'd be like CHVs or perhaps promoters or perhaps CGVs, and they would make materials that they would then post and share with the community. So they would actually make a poster about the issue and the and like kind of the data, and then they would so they'd have this poster posted publicly, and they would have like a starting point, let's say like 30% stunting, and then the next month they would say where they're at and draw a line, and so this community can see just like the one indicator, are they getting better or getting worse? And so trying to, like, I think you're right about that, simplifying it. How can we make this something that's easily digested by the community and use data to motivate change? I don't know. So I think an option for that would be cutting down on the number of indicators, and then also seeing if we could get the people who would be sharing it involved in actually making the materials. So we could give them the number or the percentage, and then like have them actually make something to share with their community, whether it be a skit or a poster or, I don't know, a speech. I don't know. Like, yeah. I think that's a really good idea, though. Something to think about.
Yeah, I think maybe we are having what I can call information overload in these dashboards. Like we have like 10 indicators at the same time in our dashboard. So it's just maybe aesthetics or something. So maybe we should identify, maybe we should be jointly identifying poorly working indicators, maybe 1 or 2 maximum per quarter, and mounting them instead of having a whole load of indicators in our boards. Yeah.
Agreed. Yeah, it's like we don't want to invest in the making the graphs, or we pay money to put the boards up. So like we want to make sure our investment in time and money is actually effective. So I agree.
Yeah. So maybe if you can go back to the quantitative part.
Mhm.
Anne has
Nyagoto.
Promoters there.
Uh-huh.
Yes.
There's one promoter that
Three.
that is not there.
Zipporah
Mora.
Ayuko.
Yeah,
Yeah.
Zipporah and Fred didn't have any data.
So Zipporah is not was with us, but she left.
Okay.
Yeah.
Okay.
About Fred, I don't know what we can do, but I know that Fred has data and he has very good data.
Oh,
So
okay.
I'll try to. Yeah. I don't know whether it will be helpful if we get the data right now. I'm surprised that was not maybe entered.
I think that for the purposes of the presentation and report, it's not necessary, because this is just a tool to help us see gaps and see strengths. But so I think it's more for internal use. But I think that's good to know now that we have Fred's data, and then through this report we'll see we need to enter it. So you need to find and enter it.
Yeah. Yeah, I was just saying because I'm shocked because he's one of our number one promoter.
Yeah, we definitely have good data.
Yes. Suppose this report will present the next promoter meeting. Like I told you, we'll have one meeting for promoters or promoters. We will want to share this.
Okay.
Yes, yeah. So at least we can explain why Fred's has no graph.
Okay.
Okay, yeah.
Mine is not a question, but I just want to thank Meki. It's a nice presentation.
Thank you.
Personally, I've seen where there are some gaps, and we are going to work hard on that and correct. Thank you.
Thank you so much. No problem. Thank you.
pale. Kaa serious. Mtu yako akipika anakungoja.
Okay, mine too is to thank you for the good presentation. And also, I can see where there are some challenges, and I think we will improve.
No problem. Thank you guys so much for all your help, really, Kevin and Ann.
Also, Meki, if you don't mind, if you can drop some of the things you were working on before you came up with this final output.
Yeah, sure. I have a spreadsheet with all the calculations, and then
The spreadsheet, the code book
Mhm.
for the qualitative analysis.
sure.
Yeah, thank
Okay.
you.
Mm-hmm.
And Mickey, do you have access to the Dropbox, or is that something that you need to send me to do?
I have access. Do you just want me to make a separate folder in the
Yeah.
Dropbox, or do you just want me to send it to you?
Your
and then-
folder, no? Your folder, on your folder.
Yeah, go ahead and make a new folder and then just send an email and let us know what it's called and where it is. I think
Okay.
it's
Sounds good.
excellent. Well, wait, did anyone have any more questions or comments before we close up for today? Okay, great. Mickey, thank you so much for this presentation. I'm so happy that we're recording this so that we can share it further with other people who've been involved with care groups, as well as, you know, other students who are interested in learning more about care groups and our Kenya project. I found this to be really informative, and Kevin and Ann and Caleb and Ameka, I really appreciate the discussion afterwards. I think that it's, you know, important that we have this data, but the next step is really in our hands as, you know, program managers. What can we do now knowing this? And I think that this kind of discussion is really helpful. So thank you, Meki, for making time for this, and thank you all for your participation and insights. This has been really informative and great.
Thank you, guys. Let me know in the meantime. I'll try to send all the documents in by today. But if there's anything in between, just let me know.
Great, thank you.
Bye, guys.
Bye, have a good rest of your afternoon.